Our next three speakers will, in a sense, will address the impact and the implications of these results on the fight, on the global AIDS response. So, Tony Fauci, without introduction, thank you.
Thank you, Stefano. I addressed a lot of what's been discussed in my lecture just a short while ago, so rather than reiterate all of that, let me just, for those of you who didn't have the opportunity to hear it, just bring out a couple of salient points that I would really like to leave as the message. I think, first of all, we have known for a long time that prevention works right from the very beginning, if in fact people adhere to the prevention modalities. When we started to develop biologically related prevention modalities, it became easier in the clinical trial process to be able to prove that something works. So those of us who are preventionists always have been saying that prevention works, and I think now, particularly in the last few months, in the last 18 months, when you put everything together with regard to the microbicides, it is very clear that A, prevention works. It is scientifically proven. B, it is clear that prevention is not, will not, and should not be unidimensional. There'll be things that work for some that don't work for others, obviously. There'll be things that are used in certain circumstances with some and not in others. So when we talk about prevention, we should talk about combination of prevention, but combinations that differ with different groups. And I think we're seeing that right now because we have solid scientific evidence regarding the studies that are under question right now, the pre-exposure prophylaxis, both in men who have sex with men and heterosexuals. We have a lot to learn more about that. The FemPrep study, I think, is important for us to not forget about that and consider it just a fluke and go back and do some serious studies on that. The other point I brought up is, and again, I just want to reiterate it so that it's very, very clear. The issue of treatment as prevention is really critical and huge. And there shouldn't be a concern about prevention that has nothing to do with treating an infected person versus prevention that is treating the uninfected person. They should all be considered in a comprehensive approach. But treatment as prevention, I do want to say a word about. Julio has been talking about this for a very long period of time, based on cohort studies, based on observational studies, based on what we see in the community vis-a-vis community viral load programs that treat special groups like he did in Vancouver with injection drug users. Now we have absolute confirmed data that he was right all along. The others who have shown that have been right all along. And the idea of the tension between treatment and prevention, we should just forget about it and just put it behind us, because treatment is prevention. It shouldn't bump other prevention modalities at all, but treatment is prevention. And one of the things I said in the discussion a little while ago, again, I just want to say it because sometimes when I even talk to people who are not in the field, they don't get it. They say, well, this was done in a discordant couple trial. So if you're infected and you're having sex with an uninfected person, by definition, that's a discordant couple. So I think what we really need to do is to just take that data and run with it. As I said, there are a lot of important things from an implementation standpoint. We need to be very measured and intelligent about the guidelines, and I know that the people who are responsible for the guidelines are very seriously assimilating all of this data, and I know that they will come out with things that are scientifically based. So I'm really looking forward to what we can do right now to build on this most extraordinary period of time that we've experienced over the last weeks to just months. It's just amazing. I've never seen something explode like this in so many years that I've been doing this. Thank you.